Another topic viewers wanted to hear about was healthcare. All of you want to expand access to healthcare. What's the best pathway to do that? And again, you will all be able to answer this question, but I'll start with Ms. Hagar.
So when I was working in healthcare, I worked in healthcare for 5 years. I got pregnant with my first son, Jude, which is a pre-existing condition. And then I was facing getting laid off from that job. And I thought back to when I had the best care, and that was TRICARE, which is basically military Medicare. I would like to see access to Medicare for all Texas families. I think that access to quality, affordable healthcare is a human right, but it's also important that we understand that we need to protect the rights of individuals and Texas families to determine what that means for them. So I support a public option.
Thank you. Ms. Sinsu Ramirez.
Look, by allowing private health insurance companies to profit off of our illness and pain, we've not only created the most expensive healthcare system in the world, but one with some of the worst healthcare outcomes of any industrialized nation on the planet. I believe it should be the right of every single American to go to the doctor when they're sick. And that will be our right with a Medicare for All system. There will be no copays, no deductibles, just high quality healthcare for every single American.
Thank you. Mr. Bell.
We need access to Medicare for all. If people want to hold on to their private insurance policies, that's fine, but we have to allow people to either buy in or opt in to Medicare if we're ever going to address the affordability issue. We also need to lower the price of prescription drugs. It makes no sense that we're paying more for prescription drugs than any other country in the world and crushing our seniors. And we also need to turn back the attacks on Planned Parenthood. Closing down Planned Parenthood clinics that have provided access to health care for thousands of disadvantaged women is only going to lead to more unwanted pregnancies and not fewer.
Thank you. Ms. Edwards.
When I was 10 years old, my father was diagnosed with cancer, and he passed away when I was 17. But through his experience, I learned about the urgency, the life and death nature of our healthcare system in this country. I think we need to have that lens when thinking about what is the appropriate next step for healthcare access. I believe we need to provide for a public option for those for whom employer-based insurance coverage does not work, but also we need to make sure that we're closing the short-term insurance loopholes, reducing the price of prescription drugs, and of course making sure that those premiums are going down, because these are all barriers that people are facing when trying to access affordable, accessible care. And those are imperative that we actually get those things done now, because lives are lying in the balance.
Thank you. Mr. West.
I agree with most of my colleagues up here that we need to make certain that we have that health care is a basic right to all Americans, that we have a public option, that we try to fix the issues that surround Obamacare, the Affordable Care Act, pre-existing conditions. We got to make certain that we deal with those issues. We have a court case that's currently in the balance. We've got to figure out exactly how the court is going to rule on that and make certain you have a senator that can address the issue. The other issue is, how do we afford to pay for it? I think that we need to kind of look at these tax breaks that were given by Trump and make certain that we create a dedicated health care account. And to the extent that we can repeal some of those tax cuts, take the money that would ordinarily go in the pockets of those 1%ers and put it in a dedicated health care account, and make certain we use that in order to change Medicare, medical system in this country.
Thank you. Ms. Garcia.
My daughter was born, unbeknownst to us, with a congenital heart defect. And at about 6 weeks old, she collapsed in my husband's arms, barely breathing. We learned after the fact that she had been slowly suffocating for the first 6 weeks of her life. And after $1.5 million of treatment, she survived. This happened in Spain. And because of that, I was able to start a nonprofit organization and give back, because we didn't have to worry about going bankrupt with the hospital bill. This is a right that every American deserves, and it makes financial sense. It's something that we can do here, and I want universal health care that looks like Spain, with no co-pays, no co-insurance, all the different ways in which they go and voice the costs onto individuals. And if we do that, we're going to have a healthier, happier, and richer America.
Thank you. Ms. Hernandez.
Well, as someone who has worked in healthcare and has seen the death of multiple people who have had access to health care, although it was unaffordable, and someone who has also worked in the insurance industry, I understand the inequalities in the healthcare system. I know how to fix them. I know that supporting the plan of Medicare for All will ensure that the maternal mortality rate is also decreased, and that women are no longer considered pre-existing conditions simply because we can have children, ensuring that no one goes without health care, ensuring that veterans are able to not just go to the VA system, but also go to other healthcare facilities that are nearby and get the access that they truly need and deserve is extremely imperative to many people across this country. And healthcare is a human right, but it is being denied by the health insurance industry.
Thank you. Mr. Cooper.
Medicare for All is a very simple fix, and it comes towards education. Again, once our youth are graduating at 18 years of age and they're now ready for work and making $50,000 to $80,000 a year, they are now paying into the system, not part of the system. Immediately, we have to expand Medicaid. I have a son that's 26 years of age. He's kicked off the insurance already. So we have to fix Medicaid, expand that immediately, and then work towards Medicare for All. And we do that by having paying, working youth at 18 years of age, not incarcerating them and not raising up the maximum prison issues. So we need to make sure that we have our youth paying into the system.
Thank you. Colonel Harris.
Yes, I support a universal health care. I'm a cancer survivor. I contracted cancer as a result of combat operations in the Middle East. I was lucky I was still on active duty, and I was able to get taken care of. I was getting paid, and I was getting medical treatment. And that was a big worry off my head. We need our people to be able to do that, to be able not to worry about getting sick and not be able to pay the bills because they're in the hospital or because they're getting treatment. I have a specific plan on how to get there, and it's on my website, victorfortexas.com, and it outlines exactly how to get there. But the first thing we do is we need to reduce the cost, and we do that through technology. So one way we support rural communities is through mobile clinics. Thank you.
Thank you. Mr. Foster.
Yes. First of all, people want a hand up, not a handout. Now, we have a system here that does not show any restoration equivalence. What I mean is a taxpayer in a rural community has to take a 2 or 3 hour trip to Houston or wherever they're from just to get to the medical center to see their doctor. There is no equality in that. It does not make the lady or woman whole when they have to do that. They're paying their taxes. We need to bridge the gap by putting some kind of Medicare center or something in between that. People need to be compensated for that.
Thank you. And Mr. Osegueda, we'll end with you.
Sure, thank you. I think a lot of our discussion doesn't focus on cost. Cost has to be beyond technology. We have shortages in doctors, we have shortages in nurses, so you're still having to look systematically in terms of whether our institutions can actually train those personnel as well. We know that it's healthcare cost that is driving that inflation. Another thing that when we talk about Medicare for All, we don't talk about the portion of the premiums that are currently paid by the private sector. So to adopt Medicare for All would be one of the biggest wealth transfers from the public sector to the private sector, because we would be fulfilling the premiums that private sector currently addresses. So it's a lot more complicated. The solutions are not going to be easy. There is no public silver bullet. Likewise, you can't ignore that the private sector is not addressing the inflation in this particular market.
Thank you.